Welcome to ABA Basics for Parents. This presentation is part of the series developed by the team at Pacific Northwest Autism to help provide parents and caregivers with information and a greater understanding of ABA and related topics. All presentations, in part or in whole, are the property of Pacific Northwest Autism. This presentation is titled, What is ABA? And is designed to give you a brief introduction of what ABA is and what its purpose is. This presentation will cover the following topics. What is applied behavior analysis? Why is ABA important? Who administers ABA? When is ABA appropriate? How is ABA administered? And common misconceptions of ABA. So what is ABA? Applied behavior analysis is the science in which procedures derived from the principles of behavior are systematically applied to improve socially significant behavior to a meaningful degree and to demonstrate experimentally that the procedures employed were responsible for the improvement in behavior. So what is socially significant behavior? It is simply a behavior that allows the individual to better function independently in society and improve their overall quality of life. Examples of socially significant behaviors can be learning how to cook a meal, all the way to learning how to use a coping skill when frustrated, and everything in between. You've probably already heard me say the term ABA 25 times in this presentation, so I guess I should probably explain what ABA stands for. So ABA stands for Applied Behavior Analysis, applied meaning for the client's betterment, behavior, which is anything a person does, and analysis, using science. We call ABA the science of human behavior. It looks at the relationship between the individual and the environment, and it can be administered in the natural environment, such as clinics, homes, schools, and the community. The scientific components of ABA include data collection. We monitor frequency, duration, and severity of behaviors, as well as systematically collect data within discrete trial programs. We use empirically based and research procedures for behavior change as prescribed by a board-certified behavior analyst, also known as BCBA. We use continuous monitoring and supervision of programs, and we use preference assessments and provision of reinforcement in response to behavior. Now that we've covered what ABA is, let's switch to why ABA is important. So ABA is currently the only therapy that has been empirically verified as effective for helping those diagnosed with autism and related spectrum disorders. As mentioned earlier, ABA is the study of human behavior, not just people who are diagnosed with autism. Therefore, it is not specific to autism, though it is a highly researched and evidence-based therapy for children on the spectrum. So as mentioned earlier, social significance is key to ABA. We want to minimize or decrease inappropriate behaviors such as elopement, yelling, or aggression, and we want to increase appropriate or replacement behaviors. Maybe functional communication is a good replacement behavior. We want to maintain positive behavior change, and we want to generalize behavior change to all environments. We don't want them to just be successful at the clinic or within ABA sessions. We want it to generalize to the community, home, and school. It is important to remember ABA does not look the same for every child. Social significant behavior is so individualized, and what might be socially significant for one child may not be socially significant for the next. So now we know what ABA is and why it is important. Let's talk about who administers ABA. There are board-certified behavior analysts, which we call BCBAs for short. They are the person who develops ABA interventions. They also supervise registered behavior technicians to assure the behavior plan and programs are being administered effectively. BCBAs are required to have a master's degree, pass a boards exam administered by the Behavior Analyst Certification Board, as well as obtain a license from the Department of Health as a licensed behavior analyst. Registered behavior technician, which we call RBT for short, are the therapists who deliver one-to-one direct services to the learner. RBTs are required to complete a 40-hour training and be licensed by the Department of Health as a certified behavior technician. They also must pass an RBT exam administered by the Behavior Analyst Certification Board. So what is the role of the BCBA? They assess behavior to determine the function of the behavior. They formalize a behavior plan to either increase or decrease that behavior. And then they create programming to increase appropriate skills or goals. They supervise the RBT to make sure that the programs are being implemented correctly. They analyze data and revise treatment goals according to the data. They maintain ongoing communication among other providers, teachers, and parents. And they reassess and revise treatment goals and behavior plans. What is the role of the RBT? The RBT is the person that your child works with every single day in a one-to-one setting. They collect the data on your child's behaviors and their program progress, and they review progress with the BCBAs regularly. When is ABA appropriate? So ABA is necessary when a child's inappropriate behaviors or skill deficits become detrimental to their everyday living and the functioning of those around them, such as family members, peers, teachers. When is ABA appropriate? To be effective, the techniques of applied behavior analysis must be in effect 24 hours a day. We always ask that parents and caregivers apply the same programs throughout their day as we apply during our limited session hours. The more time we spend working on skills in all environments equals more progress, faster progress, and happier child and family. It's important to remember that if the inappropriate behaviors are contacting reinforcement outside of ABA sessions, that they will be maintained, and if new behaviors aren't being reinforced outside of sessions, they won't generalize to other environments. So what happens when you start implementing techniques of behavior analysis inconsistently? You may start really strong when your BCBA gives you an plan to implement at home, and you might be really consistent with it in the beginning, but after a couple weeks it gets hard to stay on top of, and then maybe you're not implementing it as consistently as you were in the beginning. So what happens? Your child may make progress at the clinic as they are implementing it consistently, but fail to demonstrate progress outside of sessions, at home, in the community, at school, etc. And you may not see any or very little effect of treatment at home or outside of sessions at the clinic. It is so important to be consistent in implementing behavior plans. So how is ABA administered? We use a couple of different methods. There's direct teaching, activity-based instruction, and incidental teaching. Data is collected in all of these, and progress is always tracked. So what is direct teaching? It's what's most commonly referred to as table work or work time. It allows for a more structured setting in a sanitized environment, so fewer distractions, which can be important when learning something new or a little bit more of a difficult skill. It allows for clear expectations and more learning opportunities. In a less distracting environment, you can typically get more trials than you would in the natural environment. So, what is activity-based instruction? It's less formal than direct teaching. It's one-on-one with a therapist and child still, and teaching is included within a less formal activity or sometimes a game. For example, while playing a game of cards, a therapist can focus on teaching turn-taking, appropriately asking for cards in full sentences, etc. And what is incidental teaching? Any naturally occurring opportunity to teach a skill. For example, within an in-home session, the therapist might want to focus on increasing a child asking for help rather than tantrum when in need of help. The child cannot get a bottle of bubbles open, so they may want to tantrum. The therapist prompts, say, "Help please." Child responds, "Help please." The bottle is only then opened for the child by the therapist. There is a great example on YouTube of incidental teaching if you want to click on the link below. Now let's talk about common misconceptions of ABA. We often hear ABA uses punishment or aversive procedures. ABA is not empirically based or scientifically sound, and the nanny or daycare misconception. So let's talk about ABA using punishment or aversive procedures. Board-certified behavior analysts are expected to use the least restrictive treatment available, and aversive procedures are considered the most restrictive procedures in ABA. We are required by our ethical board to use least restrictive treatment available. And the most aversive procedures you can expect from Pacific Northwest Autism are a timeout procedure, which is simply the student is excluded from a fun activity for a short period of time, point or token loss, and privilege loss. And again, we will always use reinforcement alone first before using punishment. That is required by our ethical board. And when using punishment, we will always use it combined with reinforcement. ABA is not empirically based or scientifically sound. This just isn't true. 30 years of research demonstrated the efficacy of applied behavioral methods in reducing inappropriate behavior and in increasing communication, learning, and appropriate social behavior, according to the United States Surgeon General. Intensive ABA, so more than 20 hours per week, and early intervention prior to the age of 4, produces large gains in development and reductions in the need for special services. So it's no secret that early intervention, the better, and intensive early on is going to be the more effective way to use ABA. The nanny or daycare misconception. Your child receives one-to-one therapy, not to be misinterpreted as child care. Your child works with specifically designated RBTs who conduct individually tailored therapy programs for your child. ABA can often look like play or hanging out due to the nature of our therapy. We work on socially relevant goals in the natural environment, and staff are highly skilled and trained to make ABA a fun and welcoming approach while simultaneously implementing scientifically based approaches designed and monitored by the supervising BCBA. That's all we have for you for what is ABA. Thank you for tuning in to ABA Basics for Parents, and if you have any questions, comments, or future topic suggestions for us, please feel free to email our team at ababasicsforparents@gmail.com.